Hi, I'm Cynthia Schiller. Welcome, survivors. So, we're going to talk about the wounds that time won't heal. We're going to get into the neurobiology of child abuse and also arrested development, where the brain is unable to fully finish developing and how it affects people with mental illnesses. So, the brain is growing up until even the age of 25. So, marijuana use, alcohol use, substance abuse, and emotional and physical abuse can get the narcissist or somebody dealing with mental illness stuck in a certain state of mind based on when that trauma had happened. So this is by the Dana Foundation, and it was written by Martin H. Teacher, Teicher, and I may be pronouncing that wrong. I'm not sure. It might be Tasher, but the abuse that children go through is all over the world. And, there are things that are linked to physical, sexual, psychological maltreatment of children, also with the development of psychiatric problems. So, in order to explain how these problems happen, there are a lot of mental health professionals that resort to personality theories or metaphors. Maybe the child's adaptive or protective mechanisms have become counterproductive or self-defeating in the adult. So you can see with the narcissist, a lot of times they self-sabotage. I just got off the phone with somebody who's struggling with borderline personality disorder, and she realizes there are times that he self-sabotages the relationship and she does as well. It's a toxic relationship. Both are struggling with mental illness. She is trying to get help. He does not want to, which makes sense that the narcissist, they often don't want to change. And he's been very clear to her that he's been like this his whole life and take it or leave it. And she wants to change him. She's working on herself. Sometimes people, grow apart. He's not willing to meet her halfway, and he just wants to be stuck in that childlike state. So possibly childhood abuse may have arrested, kept locked the psychosocial development, leaving this wounded child within the adult. And while there are such explanations that might have some genuine insight, it may support patients in therapy. Too often, though, instead, they minimize the impact of the early abuse. They make it easy to kind of tell the victims to just get over it, that they're not, that the therapist or person that's trying to help them through it, they don't really get to the root of the cause. And that's when it's ineffective therapy. So research on the effects of the maltreatment appear to tell a different story, that the early maltreatment, even exclusively psychological abuse, has ongoing, enduring negative effects on brain development. We can see these kinds of brain abnormalities in psychiatric patients who were abused as children. And we are starting to begin to understand how these abnormalities might directly account for the personality traits and other symptoms that these patients are manifesting within themselves. So in 1896, the etiology of hysteria, Sigmund Freud had first introduced this topic of childhood sexual abuse in scientific context. So he believed that as children, many of his patients were sexually abused by their parents, possibly other siblings, or even other relatives. And he went on to claim that based on this new analytical method that he had, that the hysterical and neurotic symptoms could be traced directly back to repressed memories of that early abuse. And that's where these triggers happen. So because of this hypothesis, it was the birth of psychoanalysis. So Sigmund Freud later took back from this theory, refusing to believe that the childhood abuse could be as prevalent as he had initially claimed. He evolved to a more complex theory that memories of the sexual abuse were merely repressed childhood fantasies. So the narcissist lives in a fantasy world, and often memories change over time. Also, the situation can affect it. Different thoughts, different people telling us certain things. And so this theory has swayed psychiatry for almost 100 years, and it has largely blinded us to the frequency of the real abuse in psychiatric patients in their childhood and the role of abuse on the psychopathology. So physical abuse of children by their parents often remained hidden. It was a hidden problem until 1962, when there was a published article, The Battered Child Syndrome by Henry Kempe. And all of a sudden, there was a ton of publicity that led to this enactment of child abuse reporting laws. Now, I'm a teacher. We are required by law. We can face severe consequences if we don't report it. We have to be advocates for the children. So during the 1970s, there were reports of sexual abuse and incest that appeared to have increase in frequency within medical literature. And by the 1980s, scientifically valid studies of these consequences, incidences of childhood sexual abuse were being published. So, is it on the increase, or are we just becoming more aware of it? So these episodes of serious neglect, also the physical abuse, are featured often in the news, bringing it to light. And there can be a myriad of personality disorders that can arise from this. So sexual, physical, psychological trauma that occurs in childhood can lead to psychiatric difficulties that may present within early childhood, adolescence, or even adulthood. And the person who has suffered it, the victim, can feel a lot of anger, shame, helplessness, and they start to direct inward, and they start spawning these symptoms of anxiety, depression, maybe some suicidal ideation. And they could also put it as outward aggression directly, PTSD, impulsiveness, CPTSD. They can become delinquent in school. They can be more prone to substance abuse, alcohol abuse, hyperactivity. And childhood trauma is nothing to mess around with, because it can be the catalyst to ongoing persistent psychiatric disorders. So one is somatoform disorder, which is also known as psychosomatic disorder. And these patients experience physical complaints with no real presenting medical cause. And psychosomatic is where you create it in your mind. And they can honestly feel that something is wrong, but it's caused by the brain. Another is agoraphobia, which is a panic disorder. And they can just have this intense, acute, instant onset of terror. And it can be debilitating to them, especially within public if they have an attack. So more complex, difficult to treat disorders that are associated with childhood abuse are dissociative identity disorder, borderline personality disorder. Now, somebody who has borderline BPD, they often see things in black and white terms. It's an all or nothing for them. There is no middle ground. So you either love them or you hate them. It's not just, you care about them. Then they see things black and white. And, first they'll putting them on a pedestal, then vilifying them after some perceived slight of betrayal. And these people with a history of intense but unstable relationships, they feel empty. They are unsure of their identity. I just got off the phone with somebody with BPD, and she was just saying exactly this, that the abuse she went through was from her father. And it was basically the man that she was with, somebody with NPD, presented himself, of course, during the love bombing stage. But she's bringing in her father, in a sense, and wanting to come over this hill to the other side of true love and what her father didn't give her, this fantasy of what would come. But she had somebody who is mimicking the same things as her father had, and he never came over. So this is how people with NPD, BPD, they use people to get over that hump to fantasy land, where it's love and flowers and adoration and perfection. But the people that they're using aren't capable of that. And they get really attached to needing that person to bring them to the other edge, that they don't go for the healthy relationships. They need that struggle to complete the cycle that they didn't complete of bringing themselves into a fulfilled adulthood. Narcissists do it as well. They use people. Narcissists love to stay detached, and they have a lot of anger. They can have self-destructive impulses, often with substance abuse. We were talking about the arrested development, that when somebody uses even cigarettes or alcohol or different substance abuses in an early state, that it can get their brain stuck in it. So, if your person, were they more tempted to do certain things, smoking, whatever, to fit in or to look cool, and then they got wrapped up in it. In the adolescent stage, the brain is at a different state. I'll do more on that, of the different states, because the brain is different with the neurotransmitters, and that's why teenagers are more risk-taking, trying to show off a little bit more, and that's also similar to the narcissist, or people who have these borderline or other kind of mental illnesses, that they're stuck in some stage of their life. So with dissociative identity disorder, DID, this used to be known as the multiple personality disorder. That reminds me, I want to do the lady with 11 personalities. Fascinating story. So it's this phenomenon that's behind the Dr. Jekyll, Mr. Hyde, where you have to have at least two seemingly separate people will occupy the body at the same time. They don't always have knowledge of each other. Sometimes it takes becoming self-aware, going through therapy to realize that. A lot of times they don't, but then eventually they can communicate with each other. If it's allowed, one will often be dominant, and this can be seen as a more severe form of BPD, which is borderline personality disorder. But in BPD, there is one dramatically changeable personality with an intact memory, as opposed to DID, dissociative identity disorder, which will have several distinct personalities. And they often have incomplete memories. They're going from only being let out at certain times. So people that have DID, often there is a passive, depressed primary identity who cannot remember personal history as complete as the other more hostile, protective, and controlling identities. So there is one that is, there's different variations on the strength and the occurrence and how often they surface. Post-traumatic stress disorder, PTSD, this will happen with people who have undergone a traumatic event, whether it was a loss, a threat to their life, or a loss of a limb, or severe injury, such as what our combat veterans go through. CPTSD is what a lot of people go through after emotional or mental abuse, or physical, that is ongoing, and they can have a general numbing of their responsiveness, and they will often have a diminished interest in activities. They start becoming estranged from other people, and they can even have difficulties falling asleep, staying asleep, insomnia. They become irritable. They may have outbursts of anger. With PTSD and even with CPTSD, you got that brain fog, difficulty concentrating. They can become hypervigilant and will have a startle response that is exaggerated. I was at a bar, and there was this one lady who grew up really urban, really, really poor. And there was a motorcycle outside that backfired and it shocked her. She jumped, I don't even know, like 20 feet. She was on a higher level, and she jumped extremely far and hid under a table. The others of us were just startled. So I believe it brought her back to some childhood trauma, maybe guns in the neighborhood. So with the developing brain, how does abuse interfere with it? Lock people into this state that people don't want to become aware of it. Once they're aware, they have to deal with the problem and get past it. Otherwise, they're going to be stuck. And that's why when we're dealing with our healing process, we've gone through CPTSD. A lot of us are stuck, that we don't move forward. We don't live our life. And we may lash out. We may have different changes to our personality, to our happiness. And because of certain animal studies that they've done, scientists felt a long time that early deprivation or abuse may result into neurobiological abnormalities. And recently, they are studying, they saw that neurological disturbances, they feel sometimes is a possible additional source of trauma. So this person writing the article says they believe that the trauma of abuse induces a cascade of effects, including changes in hormones, neurotransmitters that mediate development of vulnerable brain regions. So they were trying to sort out this hypothesis, and they had a lot of different stress studies, and they observed the parallel outcomes in animals and people, and they believe that trauma causes brain damage, not that, and they say not the other way around. So the arrested development that somebody goes through is the state of their brain, whether it was through trauma and that's why too, to get diagnosed with a personality disorder, they have to rule out alcohol use, drug use, but it does have an effect on the brain, whether it's even nicotine, that our brains are neuroplastic, but they can be stuck in a certain state if we don't rewire the brain. And there is a loss of brain material. So depending on how severe the trauma is, relates to the willingness to change, because it can be quite painful. Narcissists like to live in the moment. They don't like to reflect. They don't like to take accountability. It's a shame-based personality disorder, to where they have so much shame that it's sometimes too painful for them to let it surface, or they're in denial. They're grieving their childhood. It is a grief, and they're stuck in pretty much a first stage. They're not, a lot of times, even to the bargaining stage, that they just are stuck, and denying that there's anything wrong with them, that they feel they're not in the wrong. Sometimes they can reflect back, and their lack of empathy causes them not to have a true connection with people. And if they don't have a true connection with people, they don't feel that they owe them anything, like respect or apologies or their true self. They don't want to share that. So through going through the grieving process of realizing what happened to them, they're gonna, if they don't do that, they're gonna constantly go to that state of trying to get to the other side of the hill, and it's not going to happen, because once they get love from somebody other than their parents, and even if they get it later in life, the pain is already there, and they're just going to use people. That's why they discard. They realize, that their tool to get to the other side doesn't cure the pain. And by the time they realize it, they've already destroyed the relationship, because they're used to the comfort zone of acting the way that they did, whether they threw temper tantrums or, when we offer love, it's uncomfortable to them. Everything has to come from them if they initiate it. But you know, the way that they're so dismissive and so hurtful that it and intermittent, it causes trauma bonds. And when those trauma bonds happen, we try to express our feelings. And when we express our feelings, that's the one thing the narcissists hate, because they take it as a personal attack from us. So I just thought it was really interesting with even nicotine, teenagers using it, or, were they 10, 11 years old when they started using, did it affect their brain? And, to what extent, how heavily did they use? And it's interesting too, that in adult life, as far as marijuana use, it can have some relation possibly to dementia, is what they're thinking. But as far as the IQ points, I believe it was 6 points lower when they used over time. I believe, based on my memory, that your IQ stays the same for the most part, that it's almost the same. You do learn more things, but I believe it's the way that they do the test. So when they use in an early age, that they have a decline. And the people that did used later on, after age 25, that were heavy users even as adults, their IQ didn't change. We do have some dementia and things that go on with age, but 6 points is pretty pronounced, that the brain is affected. So be careful with anything that you enjoy. Make sure it's healthy for you, or not overdone, or there's a lot of things that affect our brain, and the things that affect our brain affect our mental health. So I hope that was helpful, and please share if this will help somebody. Topic requests are welcome. One-on-ones are available, and hopefully I'll see you in live chat soon. Try to do those nightly. Have a good night.